Here we are to discuss about Hmpv virus. So firstly, what is Hmpv? Hmpv is a human metapneumovirus. Hmpv is a virus that usually causes symptoms similar to a cold. You might cough or wheeze, have a runny nose or a sore throat. Most cases are mild, but young children, adults over 65 and people with weakened immune system are at higher risk for a serious illness. Hmpv is common. Most people get it before they turn 5. Hmpv is a virus that usually causes symptoms similar to the common cold. It often causes upper respiratory infections, but it can sometimes cause lower respiratory infections like pneumonia, asthma, or make chronic obstructive pulmonary diseases worse. Hmpv infections are more common in the winter and early spring. Most people get Hmpv before they turn 5. You can get Hmpv again, but symptoms are usually mild after your first infection. Is human metapneumovirus just a cold? Human metapneumovirus most often causes symptoms similar to a cold, but some people can get very sick. You are more likely to get severely sick the first time you get Hmpv, which is why young kids have a greater risk for serious illness. You get some protection from your first infection and then are more likely to have mild cold-like symptoms if you get another Hmpv infection. Adults over 65 and people with breathing problems or a weakened immune system may also get severe symptoms. How common is human metapneumovirus? Researchers estimate that about 10 to 12% of respiratory illness in children are caused by Hmpv. Most cases are mild, but about 5 to 16% of children will develop a lower respiratory tract infection like pneumonia. Is human metapneumovirus the same as RSV? It's not the same, but human metapneumovirus is similar to RSV, that is, respiratory syncytial virus. It's a part of the same genus or scientific grouping as RSV and can cause similar symptoms. The peak age for severe illness from Hmpv is between 6 and 12 months, but RSV is more likely to cause severe illness in infants younger than 6 months. Now, some symptoms and causes of Hmpv. Symptoms of Hmpv includes fever, cough, runny or stuffy nose, wheezing, shortness of breath, sore throat and rash. The symptoms of Hmpv are often similar to a common cold. What are the symptoms of Hmpv? Symptoms of Hmpv include cough, fever, runny or stuffy nose, sore throat, wheezing, shortness of breath, that is dyspnea, rash, etc. What causes a human metapneumovirus infections? A virus, a small germ that uses your cell to make more copies of itself, causes Hmpv. It's part of the same group of virus that cause RSV, measles and mumps. How is Hmpv transmitted? Hmpv spreads through direct contact with someone who has it or from touching things contaminated with the virus. For instance, coughing and sneezing, shaking hands, hugging or kissing, touching surfaces or objects like phone, door handles, keyboards or toys. What are the risk factors for human metapneumovirus? Anyone can get Hmpv, but you are at a high risk for severe illness if you are younger than 5 or older than 65 or have a weakened immune system from conditions like HIV, cancer or autoimmune disorders or from medications that suppress your immune system, have asthma or COPD. What are the complications of Hmpv? Sometimes HMPV causes complications. These might be serious and require you to be hospitalized. They include bronchiolitis, bronchitis, pneumonia, asthma or COPD, ear infection, diagnosis and test. Now, how is HMPV diagnosed? Healthcare providers usually diagnose HMPV based on your symptoms and health history. They might use soft-tipped swabs to get a sample from your nose or throat. A lab tests the sample for virus and other infections. Keep in mind that you probably won't be tested for HMPV unless you have serious symptoms. Sometimes your provider may also do a bronchoscopy or chest X-ray to look for changes in the airways of your lungs. Now we come for management and treatment part. How is HMPV treated? There are not any antiviral medications that treat HMPV. Most people can manage their symptoms at home until they feel better. If you or your child are severely ill, you might need to be admitted to the hospital. Their healthcare providers can monitor your condition and help prevent your fingers getting sicker. They might treat you with oxygen therapy if you're having a hard time breathing, IV fluids delivered directly to your vein, corticosteroids. Steroids can reduce inflammation and might ease some of your symptoms. Do you need any antibiotics for HMPV? No. Antibiotics only treat bacteria. Since HMPV is a virus, antibiotics won't get rid of it. Sometimes people who get pneumonia from HMPV also get a bacterial infection at the same time as a secondary infection. If your provider prescribes antibiotics, it would be to treat any secondary infection. Now we come for the prevention part. Can you prevent a HMPV infection? You can reduce your risk of getting HMPV and other infectious disease by washing your hands often with soap and water, cover your nose and mouth, avoid being around other people when you or they are sick with a cold or other contagious disease. Consider wearing a mask if you are sick and can't avoid being around others. Avoid touching your face, eyes, nose and mouth. Don't share food or eating utensils with others. Now we come to outlook or prognosis. How long does HMPV last? Mild cases of HMPV usually last a few days to a week. If you are very sick, it will probably take longer to feel better. You might also have lingering symptoms like a cough that take longer to go away. How do I take care of myself? You can manage mild cold-like symptoms of HMPV at home by drinking lots of fluid and prevent dehydration, taking OTCs, that is over-the-counter medications like pain relievers, decongestants and cough suppressant to help your symptoms. Don't give medications to kids without asking their pediatrician first. When should I see my healthcare provider? Contact a healthcare provider if you or your child has symptoms of respiratory infections and an underlying conditions that puts you or them at an elevated risk for severe illness. Your symptoms or your child's symptoms don't start to improve within a few days, or if you or your child has a fever lasting longer than 3 days. When should I go to the ER? Go to the ER or seek immediate medical attention if you or your child has symptoms of severe illness, including high fever over 103 degrees Fahrenheit or 40 degrees Celsius, difficulty breathing, bluish skin, lips or nails, that is cyanosis, worsening of other health conditions. What questions should I ask my doctor? It might be helpful to ask your healthcare provider about what OTCs medications can I use, how do I treat my symptoms at home, What severe symptoms should I look out for? When should I go to the ER? When should I follow up with you? How long might it take to feel better? A note from Cleveland clinician. Hmpv is a common virus that usually causes symptoms similar to a cold. If you are older than 5, you have probably already had it at least once. Most of the time, you will get better at home in a few days. But sometimes, Hmpv can cause serious complications. Young children, adults over 65, and people with weakened immune system are at a higher risk for severe illness. Talk to your healthcare provider if you have any concerns about Hmpv. Seek medical care right away if you or your children is having trouble breathing or if you have other signs of serious illness.